Hello, I'm Kip Clark from Ogden Advanced Bodywork, and this is a video just to teach you some self-treatment exercises for respiratory health and immunity. So this is to help keep your lungs healthy. Obviously a good idea to do it at this time to keep your lungs as healthy as possible in case you're unlucky enough to get coronavirus. Obviously it won't stop you getting the virus or cure you if you've got it. What it will do is make your hopefully make your lungs better able to deal with it if you do get infected, and just generally keep your lungs healthy and help you to relieve congestion in the lungs. It won't drain the fluid if you've got fluid build up in the lungs. That obviously needs to be dealt with medically, but this is just a general lung health routine. Okay, so the first exercise we're going to do is the trachea massage. So that's your windpipe down here. And what we're going to do with that is we're just going to use the pads of our fingers here just to stroke down and waggle the windpipe. So as well as actually stroking down either side of the throat, we're actually trying to push the windpipe from side to side as we do it. So just do that. This is just generally good for the throat, the windpipe, and all the lymphatic system and immune system that's in the area there. Can help with got sore throats, can help you fight a sore throat as well. Okay, so that's the trachea massage. We're going to do some Chinese acupressure here. This point's called Ren 22. You've got this little dip in the middle of your collarbone here. So if you get two fingers like that, pop them into the little dip. It'll feel a bit weird, but that's okay. You don't want to push too hard so that it's really uncomfortable, but so that it's getting into your windpipe a bit. And then you're just kind of using the wrist to waggle into that point. You can just breathe normally while you do it. Obviously you're working below the voice box, so you don't want to do it on the voice box. It's just in that dip in the little bone. Again, helpful for sore throats and good for lung health. Firm pressure, but not so firm that it's too uncomfortable. Trying to keep the neck lengthened a bit while I do it, but not so much that I can't get into the into that dip. Okay, so that's massage of Ren 22 in there. Okay, next one is oh, you can do a stretch here as well. So to stretch the throat, you hook your fingers into that little dip of bone and then slowly lean back. Okay, hook in again, hooking that there. Slowly lean back. Okay, that's stretching the front of the throat. Now we're going to do some intercostal massage. Okay, so what we do here is we're going to use our fingertips to work in between the ribs. So if you come to the collarbone, just drop off the collarbone and get those three fingers there, either side of the breastbone. We're just going to do little circles like that. So we're trying to work between the ribs, loosen up those muscles, the intercostal muscles, important in breathing. And from a Chinese acupressure perspective, a lot of the points down through here are good for the lungs. Further out. A bit further out. Can go over to cross over to the other sides. It gets a bit awkward as you get further out, so I'm just going to do further out that side. I'm going to go all the way out to the edge of the collarbone. Do the other side. Anywhere that feels tender, just stay there and work it for a bit longer until you feel the pain ease or the muscles soften. Going pretty firm. I'm mainly using those 3 fingers, the little fingers, not be able to use for this. Okay, so we've done those first 3 there, so we're going to drop down and do these 3 here now. We'll start off either side of the breastbone, working them with my fingers. Trying to feel for the grooves between the ribs, not on the ribs. And I'll have to come around here. And it's good to go around the side as well. So I'm trying to follow the curve of the ribs round. Right down the side. Okay, so chest opening now. So we're now going to tap the chest, but we're going to use loose fists. So you don't want to do a tight fist. You want to have loose fists like that, a bit of a gap in the middle, and you're just going to drum your chest like a gorilla would. Get all over the different bits of the chest. So you don't just want to do the centre, you want to do the edges around the sides as well. Obviously, if anywhere feels particularly congested, then spend longer on that bit. Down the sides. The other side, so you can't reach that far. Okay, right then. So now we're going to do some Chinese acupressure, some tuina. So first point, lung 2. If you follow your collarbone round, just towards the shoulder, and you come into a little dip under the collarbone just before the shoulder, that's lung 2. Again, I'm going to use 2 fingers like that, and I'm going to work into it like that, circular movements, but trying to do the movement from my wrist as much as possible. You want to do that for about a minute. Or as long as you're able. You can support that if you need to, but that makes it harder to get into the point, so I won't do that. Okay, so if we drop into lung 2, that's kind of just below lung 1, about thumb width. So you drop over a rib. There's a rib below sorry, that's lung 2. You drop over a rib into lung 1, which is just beneath it. So just in the dip below the bone there. Again, should be a nice kind of tender feeling. You want to give these points a really good work. Very important for lung health. Okay, the other side. So follow the collarbone round, under the dip in the corner, just below, just before you get to the shoulder bone there. Again, if you can only manage 10 seconds of this, that's fine. Any work on these points is good. It's just if you can do 30 seconds or a minute, it will be more effective than if you can just do 10 seconds. But especially if you're ill, it might be too much to do that much. So just a few seconds, or even holding the points, is still helpful. Okay, so dropping over the rib, just below lung 2 to lung 1. Obviously, you can do this on someone else as well. So if you've got a family member who's got respiratory issues or disease, or is a compromised immune system, then you can do this on them, either if they're ill or just as a daily thing. Okay, right. So we'll do some more Chinese acupressure now. These are some points coming down the arm. The first we're going to do is large intestine 4. So this one, basically, you come between the pointy finger and the thumb, into that V between the bones, but then you're going to come more against the bone on the finger side. So you drop down in that groove and then hook in to the side there, in the side of that bone, sensitive bit, but sink down before you sink in sideways. Just waggling the thumb in there. It's a tender spot. Okay, do that on the other side. So in the V, push down between the two bones, and then hook into the bone on the finger side of it. It'd be a metacarpal, wouldn't it? Again, trying to waggle from the wrist. You don't want to be doing that with your thumb, because that'll be too much on the joint. You're trying to get the movement done with the wrist and the hand rather than waggling the thumb yourself. Okay, next one is large intestine 11. These are acupressure or acupuncture points. This one, you bend your arm to find the end of the crease in your arm. So just there, put your thumb on there, and then you can straighten your arm out, and then waggling in that. It's good for tennis elbow as well, but we're using it for its effect on the immune system and the respiratory system. Okay, so the other side, bend the arm, end of the crease, push there, straighten out. So it's just up against the epicondyle, this bit of bone here, slightly towards that side of it. Sensitive bit where the tendons attach. Okay, done a bit of that. So lung 5 and lung 7. So lung 5, if you've got your, if you pull your arm up like that, you've got your bicep tendon pops out here. So it's just towards this side of the bicep tendon. So it's not towards the inside, it's towards the outside there, on the crease, on the inside of the elbow crease there. Again, just using my thumb, waggling, just outside the bicep tendon. Okay, do it on the other side. So you can pull up, tense your bicep to find the tendon, just on the outside of the tendon in the crease. And obviously, it's good to work these ones as firmly as you're able to cope with. Should be sore, but not excruciating. Okay, right, lung 7. Another one on the lung meridian. So this one, you got a little bump on the side of your wrist of bone. At the base of the thumb, come down the thumb, and there's a little bump of bone there. You go over the bump, and then you come slightly more to this side. You've got the radius bone here. So you go over the bump, and it's not right on the edge, it's slightly more over that side, just slightly more towards the top. There's a little kind of dip there. So come down the thumb, over the bump of bone, and then slightly more, roll off the radius bone into the little dip on the side, just there. Again. So you're kind of pushing into the edge of the bone in a little dip inside a kind of Sided tendon, I think. If you let your wrist go floppy while you're doing it, that makes it easier to get into the point. Okay, so other side, over the little bump in the edge of the wrist, onto the side of the radius, and then slightly more roll over the bone into the little groove at the front. Can't do it on this side for some reason. Okay. Okay. All right then. So we're just going to stretch the fascia over the breastbone, over the sternum here. So line our fingers up down the centre, and what we want to do is really take some time to actually sink deep down into the breastbone through the tissues, get a really good connection there. And you take a breath in, as you breathe out, trying to stretch the tissue over the breastbone. What you don't want to do is breathe out and go and just move your fingers over the skin. So breath in, keep your posture good as well. You want to keep your chest open, neck long. Breath in, and then stretch out on the out breath, another breath in. You can come a bit further out, gradually work out. Really stretching out, and feel for any tight bits and spend more time stretching them out. Okay, a way to open your chest out, which is good for any lung condition. It's good to open the chest muscles. So what we're going to do here is we're just going to push out as we move the arm back. So take a breath in, breathe out. We're just using that part of the hand just to work through the chest muscles, push out. If you're a lady, you can work, just work above the breast and below if you feel that needs some opening out as well. Won't get the chest, but it will still help open the lungs a bit. Same when we're doing the fingers working through the intercostals. You do above the breasts and below the breasts. So breath in. Other side. You just want to try and open your hand and push, open your chest and push your hand at about the same speed. So you don't want to be doing that fast and that slow, or that fast and that slow. Try and do them together. You can, if you need to, use some lotion. Obviously have your top off and use some lotion if you feel that's more helpful to get a little bit of lubrication. Right, this is a technique which just basically helps ease the congestion in the lungs. So this is a quick vibrational technique. So what we do here is we take a deep breath in through the nose, and then just before we start breathing out, we want to shake the hands as quickly as possible while compressing them on the chest and working our way up. But you ideally want to do very quick shakes, going up like that, and you start doing them just before you breathe out. So breathe in through the nose, deep breath in, down into the bottom of the lungs. The other side. Deep breath into the bottom of the lungs through the nose. Okay, so now we're going to stretch the scalenes, which are important with breathing because they're attached to the first couple of ribs, help lift the chest up as you breathe. So to do this, we keep that shoulder down and back. Breath in. I'm going to use my hand to keep my left shoulder down and use my right hand to pull my head over to the right side to stretch down here. Breath in, keeping that shoulder down and back, and breathe out. Try and keeping the face forwards for this one. You can slightly turn the head, rotate the head left or right to try and feel. There's 3 scalene muscles, just trying to feel for which one's tight. Spend a bit of extra time wherever you feel a tight bit. Okay, you can do that a couple of times as well. So another breath in, keeping that shoulder down and back while we do it. And breathe out, and we just pull that to the side, trying to keep the face forwards. Just trying to relax into the stretch, not fighting the body, just waiting for the muscles to start to let go and lengthen. You can slightly turn your head left or right to feel for tight bits. Just adjusting as needed to get into anywhere that feels like it needs a lengthening. Okay, and again you can do that side twice. We'll do both sides twice. Okay, So the last one is doing a chest stretching exercise. I'll just take the chair out of the way because it'll get in the way of my arms. So with this one, what we're going to do, we want to keep the posture good, so neck long, chest open, and we're going to take a breath in, and as we breathe out, we're going to pull the shoulders back and lift the arms up. So we're doing together, we're pulling the shoulders back and lifting the arms together like that. Try and keep the neck long. So if I do it from the side, so let's say take a breath in, try and take the breath right deep into the bottom of your lungs, filling all the way down up into here, not just using the top part of your lungs. Breath in. Really try and lift and open the chest. I'm breathing in through my nose as well and out through my mouth. Ensure you keep your neck long, don't hunch over too much while you're doing it. Okay, and you do that about probably about 10 times. And again, you don't have to do all these exercises in one go if it's too much. You can do half in the morning, half in the evening, or you could just do whatever bits you find useful, or whichever bits you find will be able to, well, you find particularly beneficial. I hope you find that helpful, and yeah, stay well. Remember to have vitamin C, zinc, and vitamin D. Yeah, hopefully that's helped you out, and yeah, stay well. Thank you.